So I'd like to now pass it on again. And Gaynor, this time we'll start with you. So how do we respond to this? Where do we go from here? How do we respond to anti-Black racism and to anti-Black police violence in ways which really, I think, are very aligned with what public health is purported to be doing here, which is really working to reduce inequities which we see in society?
Yeah, so I come back to my first point. Thanks, May, for that. I described public health as having a responsibility to systematically identify and expose disparities in health outcomes for the purposes of seeing those outcomes resolved. And I stand by that. It's how I describe public health in almost every situation. And so my answer to almost any question, including this one, starts with that. If public health agencies in Canada are not collecting race-based data or not collecting data on health outcomes that they can stratify by race, and that includes outcomes related to injury and violence, as well as outcomes related to mortality, then we should be. Because if we cannot demonstrate as public health, who has an obligation, a professional obligation to do this work, and by the way, we are the only part of the health system that is charged with finding disparities in health outcomes. If we cannot identify that those disparities are happening across race lines, then we cannot make any arguments for change, and that is in fact the whole purpose of collecting that information. So I think that that's true for public health. I think that is also true for policing agencies, and I don't know to what degree policing agencies are on the line, but I think it's too easy for us to not collect the information, and therefore we don't have to see the information, and then we don't have to admit that there's a problem. Sometimes when we collect that race-based data, we might be surprised by the extent to which there is no problem, and that would be great news, but we actually can't say that if we haven't collected the data. And given what we know from other parts of the world, to not collect the data here on the assumption that there is no problem would be a mistake. So for me, that's step one. But I think to a point that Natisha made earlier on, collecting the data is only part of the battle, because then you have to use the data in a way that actually convinces policymakers to change. I think one of the advantages of public health collecting this data alongside of others who may be collecting this data is that public health is in the space often of being that trusted external party who is used to collecting data that is stratified amongst or across a number of lines. And so it will be no surprise to folks when public health shows up with yet another set of stratified data that says, oh look, there seems to be a disparity here that needs doing about. So it's in keeping with our role. It has us act as a sort of independent arbitrator or validator potentially of other data sets that may be collected by other agencies, and I think that's appropriate for us. When we do that, I think the other thing that we need to do, and this is true for all agencies, not just public health, is that we do need to be prepared for the challenge, and the challenge will come from multiple places. We will get the challenge even from within our own ranks around why are you collecting this data anyway. This seems to be a challenge that the U.S. has largely gotten over. They have now a decade-deep history of collecting high-quality data on a variety of outcomes that are disaggregated by race. There is a hang-up that we have around that in Canada that I'm not entirely sure where it comes from. I'm not entirely sure that I care either, having been part of this conversation now for 30 years. My strong position is that the time for excuses around collecting the data is actually over. I don't think that there's a way in which right now, given the international context that we're in, that anybody can justifiably say that this information is not needed. So I think we need to be prepared for the challenge, and we also need to be able to stride past the challenge into a new place where we're comfortable doing that. The other challenges that will come to us will be around the scary conversations that happen when you actually do collect that information and expose it, and folks do have that realization that this is information that is telling us that there is a serious problem that we can't walk away from. And that's a hard place to be. Those are scary conversations. Those are fragile conversations. We will hear intolerance of the information from a variety of places. And we are likely to make mistakes and cause hurt as much as we might be trying to cause improved outcomes. And I think all of that just has to be sort of recognized and validated going forward. I think the other things that public health agencies can do, and this is probably true for other agencies as well, is that as much as we are charged with looking external to us into communities to see what's happening there and what do we need to expose, we could be and should be prepared to turn those same lenses inwards on our own organizations and what's happening within our organizations that we've actually not taken the time to systematically document and expose for our own internal policy making. And that's everything from hiring and disciplinary outcomes to, whatever else you can manage in the human resource realm. So I think there's a capacity that we have and a skill that we have that we're really good at turning outwards to communities, but we could turn it inward to our own public health community as well. And all of that means that we would need to be then committing to those uncomfortable conversations that I mentioned before. What we want to avoid in those uncomfortable conversations, I think, to my earlier point about exhaustion, is making those conversations the responsibility somehow of the few Black faces in the organization to hold. So to the extent that we can create spaces for those conversations actually that are just part of how we do business as an organization, and whether or not we have a Black person who is leading the conversation is secondary to the need to have the conversation, I think that would be helpful so that we're not guilty of compounding what is already a difficult environment and an exhausting environment by placing a disproportionate burden on, our Black colleagues to be the holders of the conversation. I think I'll stop there.
Great. Thank you so much, Gaynor. I'm just reflecting on your last point, and I know for colleagues and friends who have been at this for a very long time, their phones and their emails have been blowing up. So everyone wants to talk to someone now about this. And one of the ways in which I have been responding to this question is, what is your organizational commitment, right? And what resources is your organization willing to invest, not just in the next week or two, but really in the long term? Right? Are we going to actually invest those resources, or is it going to be a one-off conversation and then we move on to the next thing? So thank you for that, Gaynor. I just want to flag, and this, Nana, as we go to you, one of the questions which came up consistently, which I know you're going to speak, so I just want to highlight here, this idea about what change really looks like from the perspective of the police. So there's a conversation right now from communities. Communities are calling for the police to be defunded. So what does that actually mean? And how do we not let that very community-driven message be co-opted and transformed to police conversations around police reform?
So, yeah, I think that I want to be clear that it's not a new conversation. It might be now coming to the forefront in the mainstream, but a lot of us in the community have been talking about the ineffectiveness of police, of the police systems. Specifically, I'll speak to Ontario. That's where we work. But the ineffectiveness of police and how over the years, despite that ineffectiveness, despite the fact that they are not able to do their jobs well, despite training and body cameras and everything, despite that, they still have an increase in funding. They still have, a budget, for example, in Toronto that's, over $1 billion, and the increases just keep coming in. So it's not a new conversation. I want to make sure that's clear. And, I think now people are starting in the larger community and in the mainstream are starting to get it. It's sad that it had to be at the expense and at the loss of Black lives. It has always been that, though. We have been advocating for this for so many years. And I think the concern is, they're not just ineffective. It's not just that police are ineffective in doing a lot of their work. It's that they're very harmful. Right? It's that the history of violence and the domination in our community and in the Indigenous community specifically has meant that we're overrepresented in those stats that I mentioned last time. I think the concern is, twofold. One, people say, are they really that ineffective? We don't have the data yet. We don't have the information to support that. We have decades of reports. We have, maybe it's not data across the whole province, but we have bits and pieces of information and reports that show the police do not police everybody the same way. And there's a disproportionate impact on Black and Indigenous bodies. So, you know, we've tried to do police reform. We've tried to implement trainings on implicit bias or de-escalation or crisis intervention. We've hired racialized police officers. We even hired a Black police chief in Toronto. You know, we give body cameras. We say community policing. But brutality and violence still happens for our people. And enough is enough. And we are now saying, whether you call it abolition, whether you call it a complete defunding, there needs to be an immediate reallocation of resources. If any other profession was ineffective in doing the majority of their work, there is no way they would continue to be funded in the same way, and an increase in funding. So it doesn't have to be an instant defunding of every police department in the entire world. That's fine, we understand. But there needs to be a commitment to a gradual process, at least, of strategically reallocating resources, right? And moving some of that funding away from police and towards community-based models of safety. And when we think about that, folks say, okay, well, you know, where should the resources go? Should it go to people who are more equipped? What if we just give the police more training, all of that thing? I want to remind people that the government spends a lot of resources already on Black and Indigenous people. But the resources that they're spending on us are to criminalize us and to cage us. They are not spending resources that would contribute to our full participation and our full liberation in this world, right? So we need to demand, and we need allies to help us demand, that these resources need to be you know, moved to folks who are better equipped to deal with crises, right? Who are better equipped to handle our trauma. Police and prisons are tasked right now with handling our trauma, and they're not doing a good job. So it needs to be more about mental health service providers, gender-based violence advocates, social workers, neighbors. Like, we need to have a real shift. That's not to say that we might not need, you know, a response team that deals with some more escalated issues or violence, but there needs to be a reframing of how we look at police and police safety and protection when it comes to our communities, because we are not being policed the same, and that is a problem. So I think that I will just leave it there, but I'm open to having more conversation on how that might look, because I know some people, you know, are struggling with that concept.
Thank you for that, Nana. I'm seeing the wows and the yeses coming through the chat box, so I will just leave it there. Thank you for those examples. I think I'm reflecting on policing Black lives, and policing Black lives, and others have written about this. Robin Maynard, she just talks about how, like, the police was never designed to protect our communities, right? And I think that's one of the things which we need to really grapple with, that has never been their function for Black, Indigenous, and racialized communities, and poor communities, and other marginalized communities. They were never set up for that reason. And so to expect them to protect us now doesn't make any sense. So thank you for that, Nana. Now, Tisha, what are your thoughts about this question? Where do we go from here? How do we respond to anti-Black police violence, anti-Black racism in general, from our perspective, from where we find ourselves in different sectors, particularly in the health sector?
I don't have much to add to the brilliant commentary of my fellow panelists. I probably started my work focused on the collection of race-based data, and that public health needs to actually champion that and show leadership in that. And not just the collecting of data, but when the disparities are pretty clear and obvious when it comes to Black communities, what are the recommendations, resources, and remedies that are put in place to address the disparity? It's not just identifying the disparity. The disparity should actually be a directive to tell you this is where you put your energy and effort. My work in terms of the Andrew Loku inquest has moved me more towards, not even more, squarely with Nana's comments in terms of absolute reform and what that looks like. If we're in Toronto, the largest city, with a police service with over $1 billion budget, and that $1 billion budget has led to Black people being 20 times more likely to be killed by those people, we can't keep going down that road. We can't keep funding that system. We can't keep supporting that system, training that system, and trying to overhaul that system. So, you know, it's a combination of the two. I just spent the last year developing the policy and advocating for the implementation of a policy with Toronto Police Service to collect race-based data. It was finally approved and implemented January 1st of this year, but the will to actually execute it is something else. And COVID has been used as the excuse of, well, we haven't been able to start doing it effectively because we're redirecting our energies towards COVID. And within that time period, what we've seen are the deaths of Black people in a 3-month span, not just in Toronto, but across this country and across the globe. So I support all of the commentary and statements that my fellow panelists have brilliantly made. I think we have to keep having these conversations, and we have to turn inwards in terms of our work in public health. And just to pick up on some key points that will get overlooked, I think, when we're focused on data collection, is understanding how fear, exhaustion, and surveillance need to be part of the conversations that we're having in terms of understanding how Black people are experiencing violence and how it manifests in terms of health and poor health outcomes. I'll end my comments there.
Thank you so much, Natisha. Thank you, Nana. Thank you, Gaynor, for just sharing your wisdom with us. I know the data conversation is a big one, and I'm just going to go back to there's a comment here, and someone is sharing there's a lot of evidence and data, even in a Canadian context, which has been referenced, and all indicators we collect have already pointed to the fact that, to quote Dr. Idil Abdullahi, who is at Ryerson, I believe, that Black people are in peril. And I think what that tells to me is that the data will not save us, and Natisha, you shared that very clearly when you talked about your work with the Toronto Public Health, where even in the face of the data, there's still resistance. And I think what will actually save us is shift to all the systems which both Gaynor and Nana and Natisha have spoken to, so in systems which are actually designed to improve the health and well-being of Black folks, and that will require us divesting in, and by us I mean white folks and white systems, divesting in whiteness. And in this deep-seated belief that Black lives, Indigenous lives, lives of poor people, marginalized folks need to be actively controlled and managed. And until we're able to do that, not just in public health, in the police, but really across all systems, all we'll keep doing is just trying to reimagine the systems, but it will not save Black lives. So until we're ready to fully divest in that control and dominance, we're not going to get there. So I hope that I'm hopeful that we are at a point in history where there is more commitment and will to do this. And I think for all those of us on the line who are interested in making a difference, we have to continue to hold our institutions to account, ourselves, our governments, because this will not happen. This will not be handed on a platter. It never has been. So we just need to appreciate those statements which are all coming through, and then get to work. So I'd like to thank all three of you for joining us today, and for all the participants. You're all sharing some really incredible resources and comments in the chat box, which we will share back with everyone following today's conversation. We will start taking some participant questions, so we have some time for that. So please, we have a few coming in already. So if you haven't yet sent in your question, do so, and we will try and get to that. So just get the first question here. And under normal circumstances, I would avoid this question, but I think it speaks to, Canada and how Canada thinks about racism. So I'm just going to ask it here. So the question is, oh, did I lose it? Maybe my team could help here. Okay, so the question is there any idea why this is downplayed in Canada versus the USA? We don't often hear much about anti-Black violence from police in Canada. I think this is a question which, let's see, Nana, do you want to get us started? I think to me what that question is getting at really is, what are the unique ways in which Canada thinks about race and racism, particularly around Black folks?
Well, I think Canadians, the majority of the mainstream, doesn't think that there's a lot of Black people here, and also don't know about the history of Black people in this country. I mean, I think Dr. Watson Creed, from, by being out east as well, like, you can speak to just the history, like the generations of Black communities that have, that were forced over here to help build this land, right? Our work in Ontario at the Black Legal Action Centre, we meet with communities out in the Windsor, Essex area, and we hear, they've been there for generations and generations. So it's so, we've been here for so long, and yet the Canadian government and mainstream has done such a good job of silencing that history. And if you're silencing the general history, what does that do when it comes to police violence, right? It then masks the police violence that we know has been a legacy in this country's history against the First Peoples and against our community as well. So I think it's actually, I think it's on purpose. I don't think that it's a naive, oh, I didn't know, it's only down there. I think that it has helped the creation of what Canada is right now, and it's assisted, it's assisted the status quo. It's assisted the, white supremacy to manifest in the way that it does. And so I think now with the COVID crisis, and that we're kind of having a conversation about, wow, there's all these inequities. Like, it's a disease that can affect everybody, but it's affecting us so differently. I feel like now people are starting to think a little bit differently about who it's affecting. They're recognizing the different communities. And I think especially the movements and the uprisings around, Black killings in the U.S., and especially the timing that happened with the death of Regis Korchinski-Paquette, I think that was really key in solidifying for the mainstream that it can happen here. But I think it's a very dangerous, purposeful kind of narrative that it doesn't happen here, that we don't exist, that it doesn't happen here, and that it's not as bad as, since when is one death by the police not as bad as another death somewhere else? Like, I just do not understand that. And I think one last thing, I think that is also why we can't forget that to talk about whiteness and white supremacy. I'm so glad you mentioned that, Sume, because that knows no borders, right? Like, it's an international, it's a global, a transnational issue, and if we start to say it happens only here, only there, then we're losing that solidarity that has existed and that needs to continue to exist across all Black communities across the world, because, in my opinion, that's the only way that we can really dismantle this, is we start to make connections between all of our experiences as Black people. So I'll leave it there.
Great. Thank you, Nana. We do have more questions coming in, so we'll take another one. I think you're really speaking to that very well, and I am just looking here at some participant comments, really agreeing with a lot of what you're saying. I'd like to just take a few more questions. And so one question is around how do we, Okay, so wondering if you can comment about how public health agencies can be part of the conversation around defunding/reforming the police, but still be a partner on community-led interventions. And by that, you're citing things like injury prevention, community drug strategies, which typically public health will be working with police on. So what are the opportunities there for partnership? And also for public health actively engaged in those. So I'm loving what's happening here in the chat box. So a participant there says one option, really, the option is to divest from those relationships. So that is one active solution, is if we're talking about some of the things which we've heard all three speakers speak to, where do we, as organizations, where do we want to be investing our time and our resources building relationships? Is it with systems which harm, or is it with communities who can actually use those resources to transform our lives for the better? Any comments there from our discussants?
Hi, this is
Yeah,
Oh, sorry.
go ahead.
I'm just thinking to the response that was given in terms of divesting from those relationships. It's absolutely interrogating the relationships that you have and what are the outcomes? Are they positive outcomes? Have they helped communities? Have they changed the statistics on how people are doing in terms of those relationships? And I'm sure if public health took an honest account of what is working and what is not working in terms of anti-Black racism, so using a lens that's looking at anti-Black racism, working with Black communities to assess if they are actually being helped by these interventions, they would change course. They would have to engage in very different activities and programs. And I think that's part of the thing that's not happening with public health. In my time in public health, was there wasn't space to challenge these very set ways of doing and engaging in public health practices. And we have to look inward, as Dr. Watson-Creed had said. We need to look inwards and interrogate our own public health system to see what is working effectively and what is not working, and what is assisting in the harming of Black people.
Great, thank you.
Yeah, I was going to weigh in with something similar. I think there is a role for public health to use the mechanisms that it actually has at its disposal and is charged with do, again, around it's not just using data to identify that the disparity exists. If we stop at that, then we're not practicing good public health. We have an obligation to expose the disparity, to provoke the necessary changes. That's actually the role of public health. Is why we collect that information in the first place. And we're uniquely positioned to do it because often we are sitting directly at the intersection of health systems and governance systems, including governance systems around police. So I think we do get to actually bring our skills in that to an examination of, so are we moving the markers with Black communities, yes or no? That would require us to look at whether or not the outcomes for Black communities are better for this intervention or worse with respect to police agencies. And if the answer is worse, then I think we do get the right, we do reserve the right to call those conversations. I have had several engagements in my time as a medical officer and as a regional medical officer of health for the city of Halifax. I've had several engagements with police departments, both here and in other provinces. And what I would say is that to the extent that they begin to trust public health as a partner and public health can bring that capacity to bear, and we lack the capacity in Nova Scotia in the public health system, that's a part of our challenge here. But in general, to the extent that that trust can be built, there is a way in which public health can actually help to reshape conversations and approaches. So I wouldn't consider it to be wasted effort to do that, but the skills do have to be applied in the right places.
Great, thank you there for that. Thank you, Gaynor, for that response. And I think your last point around is public health helping to reshape the conversations. For a lot of us on the line, our work is looking at how do we improve the social determinants of health for communities across the board. And I think if we can do that and engage in those conversations, we can definitely engage in conversations around race, racism, and anti-Blackness. And in many ways, I think what we're hearing from our guests here today is that resources need to be put into systems and into resources which are actually into resources and systems which are actually going to improve the lives of communities. That takes me to a question from a participant who's asking about some of those alternatives which could be used for in public health instead of policing. And they provide some examples like support for mental health and addictions, domestic violence. Are there others you can think about? Some things which public health can get more actively invested in terms of some concrete alternatives.
Yeah, it's Gaynor here. I saw a comment earlier that was suggesting that maybe policing, if we're talking about defunding police departments, that maybe it's actually police departments having a really critical look at, are they actually using the right tool for the job at hand? So appreciating that police departments and police officers get called into all kinds of situations that actually they are not the right tool for and they don't have the right skills for. Are there additional allied skills that should be brought alongside policing departments so that it's less of a focus on policing and criminalization and all of the things that are in that sector, and more of a focus, for example, on health sector supports like mental health supports, addiction supports, literacy supports, whatever else needs to be in place. I like the idea very much. I'm not sure that it's directly a public health intervention or a public health kind of scooping out the interventions from policing departments, but I like the idea of policing becoming less of a standalone event or agency and more of a multidisciplinary approach in a way that I don't think our police departments often imagine. So maybe that does ultimately mean that actually those resources shouldn't be in policing departments. They need to be somewhere else where multidisciplinary is actually a thing. But I do like the idea of a broader scope of practices being applied to the situations that come up.
Great, thank you, Gaynor. Nana, would you like to comment on that? What sort of alternatives are you exploring in your work?
Yeah, I think we are in, a different sector in terms of legal services, but as Sume knows and those who have worked with me in the past, I do like to kind of jump around to different sectors, and I've noticed a common thread and a common theme, and I think, well, I know it has to do with what we were speaking about on the last question. It's an unwillingness to give up space and an unwillingness to divest in control and dominance and whiteness. So, in criminal law, like practicing defense work, there was so much resistance to learning from clients, racialized, Indigenous, Black clients. There was so much resistance to being willing to center the experiences of someone who wasn't white or wasn't in the majority. And I think that came from a place of privilege, but also, we were seen as the good guys, quote unquote, right? We weren't the Crown prosecutors. We weren't trying to put people in jail. We were trying to help people get out and stay out. And so I think that kind of those two realities butted heads a lot. And then, same thing in public health. It's like, you folks are the good people and you're doing the good work. And I very much appreciate all the work that public health does. But I do think that as the other speakers have alluded to, without looking inwards, without looking and saying, what are the ways and what are the things that maybe we shouldn't be taking on, right? Where are the places that maybe we can start partnering with non-public health folks to be able to get the work done? And in the training that Sume and I did, last year, we were looking at those different examples. So when you look at, for example, gun violence, it was amazing to see that some advocacy around addressing gun violence from a public health standpoint included not just academics or activists or criminal defense lawyers, but also public health folks. And so I think that it's key to kind of look outside of the sector to make sure that that learning is coming from people who are actually affected, whether it's Black people, whether it's advocates in different areas and different sectors. I think that that partnership is really key with non-public health folks, just because of the the ways in which we've been taught to only look at certain things. Right? I think it's really key in all of our work to make sure that we're doing that.
Great, thank you so much, Nana. Natsisha, I want to give you an opportunity to get in here and share what you're seeing as some of those alternatives.
The work that I'm doing right now is to move away from policing first responders in mental health crisis calls or wellness checks. I don't know how we ended up going down that road where the police are arriving first, and they're arriving without any mental health support nurses or social workers or mental health support staff. And what we're seeing are the fatal outcomes from those interactions of people who are not equipped to address mental health crisis in an appropriate manner. I wouldn't call the police if I was having a heart attack. I wouldn't call the police if I broke my leg. Why are we calling the police when someone in our family or a loved one is having a mental health crisis? You know, it's the same way. If we look at how policing has almost invaded our society, public health is out of our school system for the most part, but we've put police in there, and we're fighting to get police out of schools when public health experts and staff should be the ones that are the first responders in dealing with the health issues and different societal issues that we know are impacting the determinants of health and poor outcomes for Black people. So, you know, I heard Gaynor say that the resources for public health in Nova Scotia are thin. I think they are across the whole country. So why aren't we looking at beefing up those budgets, the public health budgets, and look at people who are actually doing the work that is about the preservation of life of Black people, as opposed to beefing up the budgets of the criminal justice system. So, you know, I'll just add those comments, but I think my colleagues have very well stated some of the alternatives or different ways of thinking or the different narratives we have to start thinking. Maybe the last thing I'll say is that the pushback that we're getting in terms of the collection of race-based data because of the fear that it will be used inappropriately against Black people. What I've been telling people now is that we're already dying. We're being killed. It's not going to get worse by collecting race-based data. So those are some of the things that we have to start pushing and changing the narratives and conversations that we're having.
Thank you for that, and just thank you for highlighting that pushback. I know that a lot of people on the line are feeling that too, and really think about how they move forward with these conversations in our various spaces. I think I'd like to start by thanking all three of you, Natisha, Gaynor, and Nana, for really having this really grounding conversation with us. And I know for myself, I'm leaving here, you know, fully energized, knowing that this is a very big issue, but it's also very solvable, and we need to have the will to do it. Natisha, you talked about investment, right? I think another place which we want to be invested is in organizations who are already doing this work, who already understand what it means to provide services and support for Black people in ways which are holistic and affirming. And I think about organizations like the one you led for many years, Natisha, Women's Health, Women's Hands. There are tons of organizations like that which are community-led. And what happens is a lot of times those organizations tend to be chronically under-resourced. So I think that's another place where we want to be invest in our resources. I thought I would close us up here with this poem from Langston Hughes. He says, I look at the world. I look at the world from awakening eyes and a Black face, and this is what I see. The sense of narrow space assigned to me. I look then at the city walls through dark eyes in a dark face, and this is what I know, that all this walls oppression builds will have to go. I look at my own body with eyes no longer blind, and I see that my own hands can make the world that is in my mind. Then let's hurry, comrades, the road to find. So I think I'm hoping that this word from Langston Hughes leaves us all energized, knowing that there's lots of work to do, and there are lots of solutions available to us to start to make some really deep and meaningful changes in our communities. We do have some resources at the end of the slides, which we will be sharing after, and which you can reference on your own. So thank you all for joining us today for this conversation. We didn't get to all the questions, but we will be going through them and sending out some responses as we're able to. And again, a big thank you to Gaynor, Natisha, and Nana. This has been an immense pleasure. Take care, everyone.
Thank you, Sume.
Thanks so much, everybody. Thank you, everyone. Thank you, Sumi.